Hi, welcome back to Golden Years. My name is Mildrene Volcy, and today's show we will talk about a really great subject, and also we have a wonderful guest, Miss Claudia Fine. She will be explaining the subject that we have. In today's show, we will be talking about senior generation, and welcome back again, and welcome back. Welcome, Claudia. How you doing?
I'm doing great. Thanks for inviting me.
Thank you so much for accepting. It's a pleasure to meet you. Can you tell us a little bit about you?
Sure. I guess I would define myself as a social worker. I started out in social work, but I also got involved in population health, public health, and I, over the years, have had multiple jobs, but I would say that it's been in healthcare for the most part. I worked in, one of the first departments of geriatrics, and the first department of geriatrics in the country at Mount Sinai.
Oh. And was that in New York? Or?
In New York at Mount Sinai Hospital in New York. And fell in love with working with the elderly and their families. We were talking about sandwich generations.
Yeah.
I ended up having too many children, and I couldn't work full-time, and I too had to take a step back, much like some of the people that we're going to be talking about today. And I started working part-time and seeing people privately about concerns that they had about their aging loved ones. People who were concerned about how to access health care, how to manage their parents. This was a long time ago. I'm not going to tell you how long ago this was. But the issues were still there, and I started to go make home visits, see how people were functioning in their homes, and I started a care management business. Over the course of several years, that business grew in New York City, and it was acquired by an entrepreneur.
Oh, really?
Yes.
When was that?
Well, actually, our care management business, which was called Fine and Newcomb Associates, was acquired by a company that still exists, and actually there's a branch right here in New Jersey called Senior Bridge. And the person who founded that was somebody who saw that providing care really needed more than just somebody, giving you an injection or helping you to bathe yourself or changing your bandage.
Yeah.
But it really required an understanding of what people need and how to coordinate services, care management.
Yeah,
and so he acquired our business and incorporated it into this company called Senior Bridge. And I continued on with Senior Bridge for many years until Senior Bridge was acquired by Humana.
And you transferred?
I transferred with Humana. Yep.
Mm-hmm.
And all of this time basically recognizing that people were not getting the care that they needed to stay well in hospitals. They got cured temporarily, and then they got discharged, but then they got sick again and they went back into the hospital.
Yeah.
Exactly.
Yeah.
So a lot of our work at Humana was around that. But one of the things that I learned in Humana was that, there were care managers, nurses, and social workers who telephonically and in person would go and try to help people. But at the end of the day, whose responsibility was it to take care of this aging person?
Yeah, of course.
The family.
Oh, yeah, of course.
The family.
Yeah, because the family is
Did the family have any information? Did they have support? No. They had to do it all themselves. And they frequently were managing their job and their children.
Yes.
And that's what we call the sandwich generation. These are sandwich caregivers. They are responsible for children and getting work done, making an income, and then their parents or their aunts and uncles, their aging loved ones.
Yeah, because if you are with a loved one 24 hours, even though you have, let's say that you have somebody that come into your home for a couple hours, at the end of the day that person leave, and then again you are the main priority, or the loved one becomes the main priority, and you have to take care of. You're responsible. It's your responsibility to take care of that. You're also responsible to make sure that the loved one go to the hospital if needed, the doctor's office if needed, taking the medication if needed. So, and also that also with being said all of that, I know there's also the money part of it. So can you tell me, I know you just explained to us what is the sandwich generation. So that's the explanation where in which people who have their own family and responsible for their loved one.
Right. And
Yeah.
I think generally what we're looking at is people between the age of 40 and 60. And the reason that population is that people are having children later. They're having children later because it's hard for the millennials and pre-millennials to get
Yeah.
themselves going and have families. They got to, it's hard to make money. So they're having children later, and their parents are living longer. But they're living longer. They're not dying at like 50 of a heart
50,
attack.
yeah.
Instead, they're living longer with congestive heart failure or diabetes. And so what we're having is people who are needing this kind of support, what you've referenced, sort of hands-on support. But sometimes it's just emotional support. Sometimes it's financial support. And those are the people that, the adult caregivers, the family caregivers, have to take care of.
You mentioned about the millennials that having, or people that are having kids later in life, in 40s and 50s. So by that time too, they have a loved one who stay longer. So it becomes challenges for anybody who is in that position. So what do you think make it so challenging? Is it financially? I know you mentioned about also supporting, emotional support. Is financially could be a part of that challenge?
I actually think, I'll address the financial part, but I want to step back a little bit and say that one of the biggest challenges are that we don't get it. We really don't get the fact that people do get older, and they do, like children, you have to take care of a child, and they eventually grow up, and then you don't have to take care of them, hopefully, unless they have disabilities or whatnot. And more now, maybe they have trouble making a living, and they
come
boomerang back, and that's another financial
issue,
burden for this sandwich generation. But I think that a lot of us don't really recognize the fact that there's going to be a period of time where we will age and we will not be able to take care of ourselves, or we don't prepare for that rainy day.
Oh, okay.
We're in denial. And we're also in denial because we think that somehow our medical system will cure us. We focus on cure. We don't focus on care. And actually, our insurance doesn't even pay for care. It pays for cure. If we're not going to cure you,
then
you're on your own, honey, and so there's a lot of this. The other thing is that family caregivers can be caregivers in lots of different ways. They can be, in the home taking care of mom who can't walk and needs to be. Or they can be across the country basically coordinating services for somebody, or just paying that person's bills, or coordinating the neighbors, or communicating with the doctor and advocating for services. There's all different ways of being caregiving.
Yes. Okay. You mentioned something about we don't think of why we have this conception where we know and back in the heart or head that it will grow. Why this conception or the resistance of not being prepared?
We don't want to think about getting old. We have been a youth-focused society. We don't want to think about death. Nobody wants to think about bad things.
Okay.
And so, and I think part of it is people need that kind of coaching and support to help think about that. which is why, I've actually now gone on to do something different, which is to support family caregivers, just them, not their
not
patient.
the lover,
Yes.
not the patient, not
Right.
the client,
Right.
just them who is taking care. Because I'm not saying it's going to be a burden, but if you're responsible, to me it's a little bit of burden, but not that your parents are burden, but to me, especially if it comes to financial, or if it comes to time and things like that, it would, especially if you have another family that you have taken care of, so it becomes a little bit hard on you.
Well, I think the biggest stress, financially and also caregiving-wise, is that families don't really know what the resources are out there. They don't know how, even financially, there are resources. There are social service resources,
Yes.
not as many as there should be,
Yeah.
but there are. But most families don't know about that. And even if they do, it's very difficult and stressful to access. And so they need more support. Our healthcare system doesn't really have the resources to provide that support.
To us, so, yeah.
So, I think it is very important that families get that support.
And what are you doing now? Because I know that you talk about what you were doing before. So what exactly you're doing?
So one of the things that I right now, I am the chief professional advisor for a company called eFamilyCare.
Okay.
And eFamilyCare is an app. It's a tech company
Yeah.
that essentially allows a family caregiver to message their own private care advisor pretty much any time. And within 2 hours, they'll get a response. They'll also be able to get an evaluation by using forms and, how can I figure out what financial resources my mother's eligible for? Well, let's put the information in here and let's see. So the care advisors can do this, and it's all online. It's much more cost effective than having, a private your lawyer or a private geriatric care manager. Not to say that these resources aren't very valuable, but I think sometimes a little bit goes a long way, and having a relationship and access to somebody who you can consult with when you need it, especially when you are in that sandwich situation and you're under so much stress.
Okay. So basically, you work as a vice president. You mentioned that.
I oversee the advisors. We have
advisors.
advisors who are, clinical specialists, social workers, nurses, who essentially respond to people who reach out and say, I need help.
Okay. There you have it. We will be taking a break for a short minute, and we will come back and talk about what is the sandwich generation and what we can do to help others in that situation.
It's an onion.
Hi, welcome back to Golden Years. We do have Miss Claudia Fine here, and we're talking about sandwich generation. Therefore, Miss Claudia, what do you think is the number one, based on your past experience, based working with eFamilyCare at this moment? What do you think is the number one misconception people have about caregiving?
Honestly, it's that insurance, Medicare, pays for
Everything.
It is the number one misconception, without a doubt. There are other things, but that is it. The other thing is that people have the misconception that if you can't function, then you should get care that is paid for. So not being able to walk, not being able to feed yourself. We call these activities of daily living.
Yeah, yes.
And so people believe that that's an illness, and that they should be able to stay in the hospital, or if not in the hospital, certainly in a nursing home. But that's not the case. And more, actually just recently, as of January 1st, Medicare is paying for less skilled rehab, which is going to be in the home. And actually in rehab, which is going to be devastating for our...
They will stop or they will start?
Less.
Or less pay. Oh.
Right, less amount of services. So, people are not, they're not going to pay for you to get better. They'll pay for a certain amount, and then you're on your own. You have to pay.
Yeah, but do they understand how many people there are suffering out there?
I don't think that's something that they factor in. What they don't understand, which they should factor in, is that it's really counterintuitive. That in fact, by not helping people to function better, what they're really doing is having people go home, fall down, get sick, and come back into the emergency room and spend more money on acute care, which just increases the cost of health care.
Oh, wow.
And they should understand that.
Yeah.
But they don't.
But what can people... I know that they have a misconception that Medicare or Medicaid will pay for everything until they realize they cannot get the care they needed through Medicaid or Medicare. What advice would you give somebody like that? Don't have that misconception, or be ready, or what advice would you give to someone that not only the century generation where they have their own family and take care of loved one, and they're looking all over the place for somebody, for some help, or an elderly one who doesn't even have somebody, or a children, but what can they do?
Well, I think the big thing is that sometimes for some people, what is it, the horse is out of the corral. It is what it is, and it's but I do think I want to clarify, Medicare is an acute care insurance. Medicaid does pay for some care. It may not pay for what you would want, but it does pay for long-term chronic care. So I want to make sure that people know that. So one thing is, financial planning. Make sure that you put money aside for that rainy day. If you can afford long-term care insurance is something to think about. Keeping track of, talking to an elder law attorney. All of those things financially are really important from a financial point of view. The other thing is, look to your community, look to your family, make plans, talk about these things before the crisis. Get your advanced directives in place.
Yes.
All of those things are really, really important. Don't put your head in the sand and say, I cannot tell you how many clients I had that said, I just want to die. I'll be struck by lightning, it'll be over. It doesn't happen that way, especially now.
I got one personal, not question, but I know somebody close to me who's going through this right now, that he has his mother who fall down at home and went to the hospital, and he thought that was going to be 1, 2, 3, and end up staying at the hospital for 3 weeks. So now, he still have his job, he still have his own family to take care of, but he's becoming so overwhelmed, and it feels like either he wasn't ready for it, or he doesn't know what to do. So what advice would you give somebody that are in those kind of position where they have, or they didn't expect it, they know the mother or the father or the loved one is getting older, but there's a crisis that they expected, and now they're just overwhelmed by the situation?
Well, I think asking for help is very important.
Yeah.
Not, don't take it on yourself. A lot of times people feel, especially with, a parent, it's my mother, it's my responsibility.
Yeah.
And sometimes, this is sort of an interesting dynamic, but in families, there's competing for the mother's love, so
Yeah.
I want to take it all on myself without recognizing the stress that it's causing you. Share. The other thing is, get help. Go online, talk to people, go to social services, see what's out there. Don't isolate yourself, for sure. But with this personal situation, the person is in the hospital for 3 weeks?
Yeah, she has been in the hospital for the past 3 weeks, and she went for broken legs, and ended up having all type of problems after that. Mind you, I think she's 82.
I mean, that's something, people say, you're much better off getting out of the hospital. Hospitals we think of that, oh, you got to go to the emergency room, you got to go to the hospital. Sometimes it's a lot better not to go to the hospital.
Yeah.
So, I also believe that getting an advocate for you in a hospital, speaking to someone who, someone in the hospital who's an ombudsman, finding out what's going on. Why is this 82-year-old woman who broke her leg still in the hospital? Does she have an infection? What's going on?
Yeah, I think it's becoming so overwhelming, not even asking question. And looking at him, seeing him going through that, I feel like there's other people that might have that probably is.
Well, this is exactly the kind of situation that eFamilyCare would help with. It's the kind of thing where you just go online, you say, these are my current concerns, can you help me? And someone will try and help you figure out what's going on, ask the right questions. And you don't have to make an appointment, spend a whole lot of money, that's the kind of thing. And there needs to be more resources like that. People don't know where to go.
People don't know. So, okay, if they don't know where to go, is the hospital, I know that the hospital has some sort of...
They have social workers.
There's a social worker that can help them as well.
Absolutely.
Right? There should be able to
There should be, and there are ombudsmen who are patient advocates.
Yeah, to help people in that situation.
And they should avail themselves.
Everything. Okay. What any kind of advice would you... I know that we talk about, my friend always in that situation. I know that we talk about financial issue that any century generation is having. What would be the last piece of advice that you give somebody right now watching it? Be like, okay, this is my situation. I have a loved one, whether the loved one is in the hospital or nursing home or at home, but I have my family, 1 or 2, 3 kids. I also have myself to take care of. But then again, I completely forget about myself, and then taking care of children and taking care of the loved one, worry about both the end of it. And so what would you, some people are taking it very well, but some people are still stressed about, still overwhelmed. What would be the last advice would you give them?
Well, caregiver stress and caregiver burnout are really serious. It's not just a kind of cute name. It's really serious. And caregiver burnout is, basically can create psychiatric and medical problems, real problems. So I think a caregiver always needs to know that they need to take breaks. They need to have resources, even if they're just little breaks. They can't take it all on. No one can take it all on themselves. Even a small, it may not even be like a very big complex situation where you're bathing mom and she has dementia and it's high stress and blah, blah, blah. It could be even just being concerned that mom's getting older and you have to go once a week to help her with her bill pay. Even that, having that responsibility on top of just living your life, taking care of your children, holding down a job, can really push someone over the edge. So being able to talk to someone about it, allowing yourself to say, this week I can't do it. I'm going to send someone else. Or I'm going to go twice next week. Give yourself a break. Very, very, very important.
Yeah, give yourself a break. And I know that you talk about caregiving burden. Some people don't know what it is until they break down. So what are characteristics that to say, like, if you're feeling this way, I know if you're feeling, people, sometimes when people feeling stressed, they don't know they're stressed.
Well,
or they're angry, they're like, oh, I'm just
well, you just said,
So
there
what
are
are the
certain
characteristics?
symptoms,
Yeah, what are the
very clear
symptoms?
symptoms. Problems with sleep, problems with weight loss, problems with weight gain, loss of appetite, you know, emotional lability,
Yeah.
up and down, 1 minute you're happy, the next minute you're angry, that kind of thing. Feeling, actually body pain. When you walk around like this, you're going to get muscle pain and tension. All of these things are symptoms.
All of the symptoms. So if you feel those kind of symptoms and you know what, if you look around yourself, you know what's going on. So you should say, oh, okay, I'm probably burning out.
Right. You may not be burning out, but you're
but
stressed.
you're
And if
stressed a
you
lot.
don't address the stress, you will burn out.
Oh, I see. Okay.
So there are two levels. Every caregiving is stressful. Can't avoid it.
Okay.
Manage the stress.
Yeah.
If you don't manage the stress, you will suffer from caregiver burnout.
Burnout.
And burnout is actually like a very serious problem and can lead to a lot of, real illnesses that contribute to, real illness, mortality, and morbidity. For example, there are studies that have shown that people who are caregivers of people with Alzheimer's die before the Alzheimer's patient
Really?
because of the stress of caring for a difficult dementia patient.
Oh, wow.
So it's serious stuff. Caregivers need help.
And there is help out there. They just have to look for it.
There should be more.
There should be more, like you mentioned.
There
before.
is. There's less help in the healthcare system because they're focused on curing people.
Yeah.
And that's part of our struggle.
Okay. Well, there you have it. We were talking about senior generation, and for people, I know for a lot of you or some of you who are in that situation where you have to take care of family, of your kids and also a loved one. Could be your dad, your mom, or a cousin, or it's anybody, whether that person is at home, hospital, or nursing home. How do people find you?
eFamilyCare.com.
eFamilyCare.com.
Go right on there. We are on Instagram. You can follow us on Instagram and Facebook.
You will be there.
I'll be there.
Well, there you have it. Thank you so much, Miss Claudia. I really
Thank you for
appreciate
inviting
it.
me.
Yeah, thank you. And that was a really good conversation, and we really appreciate it.
Thank you.
Thank you.